Thanks, Jack and Jason, for having me on. I'm really excited to chat about Bitcoin, especially as a medium of exchange. So love the name of the podcast. And I think as we're moving into the
Thanks.
medium of exchange phase, we really see Bitcoin come to life as it was originally intended as a digital peer-to-peer cash system. And my background is in the healthcare industry, started out consulting for hospitals and health systems, and then moved into an insurance role in Medicaid, over into product management, launching an innovative product in the hospital space in an operating room. And really, as I was completing a double master's in health economics and policy in 2020, and the pandemic hit, we didn't need to be in person in the office anymore, where I was working outside Chicago. Definitely started to just change my worldviews and see what was happening, getting married, and just asking the question, what is money? And so I started my Bitcoin journey really in 2020 and 2021, going pretty hard and fast down the rabbit hole, reading as many books as I could get my hands on, listening to podcasts, and eventually going to the Adopting Bitcoin conference in El Salvador in 2021, November, shortly after they made Bitcoin legal tender. And after interacting with a lot of the builders in the Bitcoin space there and just experiencing Bitcoin for myself, realized this is really where my passion is and where what I wanted to be working on. And following that conference, I noticed, no one was talking about Bitcoin in healthcare. And for me, as working in the space of an industry that is 20% of the US GDP and almost $5 trillion a year in spend, where a quarter of that's administrative and half of that is waste, there's just such a huge opportunity for Bitcoin to come into the space. So I'm really excited to, and at that point, left the corporate job, did some traveling with my wife, did a yoga teacher training in Bali. And while we were locked up in a hotel room quarantining because of COVID in Jakarta, I was writing down all the ideas and things I had on how I thought Bitcoin could come into healthcare and integrate. And so been fortunate to be able to work on a lot of those ideas and have that come to life over the last few years, starting out with working at Crowd Health as an alternative to health insurance with a strong Bitcoin angle there, and then realizing, hey, where are the docs who are going to be accepting Bitcoin? There is really strong centralization forces in healthcare that have made it difficult for independent providers to continue to grow their business. And so I thought, hey, Bitcoin is the perfect solution that can be integrated into many business models in healthcare that are springing up, like direct primary care, for example, is one, or either direct specialty care, surgical centers that list their prices transparently, and actually what you're buying. What a concept. In healthcare, everything is hidden behind third-party payers, and only about 10% of our spend today is out of pocket or direct pay. Everything else is coming from third parties, whether it's the government or third-party insurance companies. So I started Satoshi Health Advisors a couple of years ago, really with the goal of helping healthcare businesses integrate a Bitcoin strategy, and starting all the way from understanding Bitcoin, but even first understanding what is money, here's the fiat system, here's how Bitcoin and Lightning works, starting there and distilling a lot of the lessons that I've learned in my own research, presenting different options for integrating payments depending on their business model. Is it in person, is it online, e-commerce, who are their customers? Saving by accepting Bitcoin payments is one. Obviously, there's a huge philosophical element to it of adopting sound money, but it makes sense from a business perspective because Stripe is charging 3%, and with Bitcoin and Lightning, fees now, onus is on the user, really, and you can lower your fees to 0 to 1% depending on who you're using to process payments, and how sovereign you want to be in running your own node, of course, is an option. Saving in Bitcoin, so treasury strategy, understanding the different options that are out there, and then ultimately marketing to Bitcoiners and being able to grow your business and reach a growing niche of consumers that are looking to earn Bitcoin rewards and or spend Bitcoin and support businesses that are on a Bitcoin standard. And so I've been able to work with a few different businesses in the space, both on the provider side, different wellness brands that are more e-commerce based, and then even other businesses that aren't as health related, such as even e-bikes, or more recently an architect who's got some exciting offerings coming out too. So I think with Bitcoin into health, there's just so much potential. And then with NOSTR coming into the equation as well, that's something I've been focused on through a company I co-founded called NOSTR, which is focused on integrating using NOSTR for healthcare use cases, and as well as Bitcoin as money. You see a lot of hype around blockchain for healthcare over the years. Oh, we need a token for this and that. And we're seeing is that none of that really caught hold. And I think The reason is because we only need one blockchain, and the best use case is for decentralized money that everybody's hooked up on that ledger, but we can utilize NOSTR's public-private key cryptography and for identity management, and ultimately hopefully break down more of the silos that exist in healthcare, more interoperability, and ultimately sovereignty for people to take personal responsibility for their health.
Jon, can you loop me in on the Nostr tie-in with Nos Fabrica? Because I think of Nostr more as like a social media platform.
Yeah, so a lot of the use cases right now in Nostr are certainly social media, kind of Twitter, X clones in a way. But if you think about what Nostr is, notes and other stuff transmitted by relay, you can think about health data being some of that other stuff. And there are international standards for healthcare data called FHIR or HL7 that we can wrap in Nostr events. And now all of a sudden, if you're using this data structure, which are just JSON notes, simple data that you're packaging back and forth, we can do it in a way that's encrypted and that you have control ultimately over your own health records, which doesn't really exist in the system today. So it's still very early days. It's pretty experimental. We have an ongoing challenge with 14 million Satoshi bounty, a reward pool that's out there. And we're about halfway through now, and some really interesting apps and use cases and people building open source tooling in the space. But if you think about health, it's social, right? Health is very social. You have your family members, your other loved ones, people who are along the ride for your own health journey, whatever is ailing you or you want to improve. There are certain aspects of health that you'll want to share, and we can utilize Nostr's Web of Trust and also social networking tools, I think, in this health context. And so it's been really interesting to work on. And then as open networks grow, just as anyone working on Bitcoin, the Bitcoin network and accepting Bitcoin is now a part of this network, we see Nostr in a similar light from a data and communication and identity perspective. So that's kind of the Nostr tie-in now, and I think eventually there's some other work and another business that I'm excited to share coming up soon that'll also be at this intersection of Bitcoin, health, and Nostr, and I think tying a lot of personal motivation and goals to ultimately getting more sats, stacking more sats, and sharing with others, and creating circular economy in healthcare. I think that's where we're ultimately going with this, which is how can I, as Bitcoin continues to appreciate in purchasing power year over year, there are certain things in our life that we know we're going to have to spend on. And I think health and healthcare expense is certainly one of those.
Yeah. And I think one of the things that you're helping highlight that most people don't even realize is that we don't own our data, just like Bitcoiners realize we don't own our money. And, I was doing some research before this on a company that I'm sure you're pretty familiar with is Epic, that hosts like almost half of the electronic medical records in the United States alone. And that ties into this question of, you mentioned waste, and just I have some experience consulting in the healthcare industry as well and understanding like the complexity. Revenue cycles, for example, are processes that are so drawn out, and it can actually take like months for these hospitals and doctors to get paid for their services. So can you just explain a little bit about how you're using the idea of Bitcoin and really just simplifying down how these doctors can, one, take control of their data, back to what you mentioned on Nostr, but then more importantly, or just as importantly, take control of their money with Bitcoin?